15 World AIDS Day in Gambella with various programs including voluntary counseling and testing for HIV. On the occasion, around 3,500 people were tested for HIV, a massive turnout that is said to be a world record for HIV tests done in a single day. The government, however, stresses that commemorating the day has important meaning than just breaking a Guinness World Record on the issue. The event also served as a platform to unite in the fight against the virus. Hailume Dexa has been to Gambella and has come up with the following account.
World AIDS Day was the first ever global health day, which is held on 1st December each year. It is a great opportunity for people around the world to unite in the fight against HIV and to commemorate the people who have died.
The World AIDS Day is a day that the UN thought of since 1988 to be able to observe what has happened in terms of HIV, what are the advances that have been done, what are the challenges, what remains to be done, and that is why we have always observed the World AIDS Day every year since that time.
Here in Ethiopia, the 2014 World AIDS Day was marked in the state of Gambella with various programs including blood testing for HIV and counseling services. On the occasion, around 3,500 people were tested for HIV, a massive turnout that exceeded the expectation of organizers who had hoped to test 2,000 people. It was said to be a world record for the number of HIV tests done in one day. For Ethiopia, commemorating this year's World AIDS Day in the state of Gambella has significant meaning than breaking a Guinness World Record on the issue.
We are commemorating World AIDS Day in Gambella because Gambella is one of the regions that has highest HIV prevalence in Ethiopia, close to 6 times the national average. The national average HIV prevalence is 1.1%, and in Gambella it is 6.5%. So Gambella has one of the highest HIV prevalence rates, and we want to use this World AIDS Day as an opportunity to strengthen the social mobilization and the HIV prevention activities in Gambella.
በጋምቤላ ክልል HIV ኤድም ትርጭት በሚፈለገው መጠን ለመቀነስ በርካታ ጥረቶች ቢደረግም
Despite several actions to prevent high HIV infection in Gambella, the prevalence is still high, especially in some rural parts of the state. But in the town, there is small reduction.
There are many factors that have been increasing HIV infection rate in the state of Gambella compared to other states of Ethiopia.
Socio-economic, cultural, and poor implementation performances are some of the factors that have been contributing for the high HIV prevalence in the state of Gambella.
Like any other places in Ethiopia, women and young people are the main vulnerable segments of society in the Gambella state. Majority who got tested in this year's World AIDS Day that was held in the state were young people. They said knowing their HIV status helps them to make informed decisions about their lives.
I am protecting myself from HIV because I love myself and I need to live long. In addition, I need to contribute my own share for the development of my country by protecting myself from HIV. To do so, I need to be loyal to my girlfriend.
Before starting serious relationship with their boyfriends, women have to test for HIV. We can reduce HIV prevalence significantly if we are making a wise choice in this way.
It is for each and every individual to be tested and know his or her status and the awareness should be taken to the grassroots level, because like in the urban areas, people are not aware about the HIV and AIDS. So it is very important that if government can make an effort, to make an awareness with the grassroots, so this can contribute to limitation of HIV/AIDS rate in the regions.
To prevent and control HIV prevalence in the state of Gambella, local and federal governments have been taking several actions over the past years. Conducting comprehensive survey on the issue was one to mention. Based on tangible evidence gained from the survey, the federal government has designed a plan which was endorsed by the local government and cascaded up to the district level. In the plan, the critical steps to prevent and control HIV infection were clearly outlined.
The first one is to implement the strategies that has helped Ethiopia reduce new HIV infection by more than 90%, which is the community conversation. So people have to talk about HIV, how it is, spreading, what are the risky behavior, attributes that result in acquiring HIV, and so on. So community conversation, and for the community to make HIV as a priority agenda for themselves and to engage in, behavioral change communication is very important. So we aspire to implement this community conversation in all communities, in every village across Gambella. This will be the most important strategic interventions that would improve awareness and bring about behavior change. We will test a quarter of Gambella's population, which is around 100,000 now. So we are planning to test 100,000 people over the course of the next few months before the end of the budget year, and this will, let adults in Gambella know their status, and following counseling and testing, access to treatment has to also be there. So we will expand the HIV treatment sites to all primary health centers in Gambella. They have now 32 health centers, and all of them will be in a position to provide treatment, and will also improve the diagnostic capacity in the region.
Ethiopia is one of the world countries that have been committed to create HIV-free generation in 2030. The country is hopeful to realize this ambition even before the deadline.
We put now more people on treatment than the new infections we get every year, and this means Ethiopia is at a tipping point to have an AIDS-free generation, not by 2030 but earlier than that. So that is my judgment, or assuming that the current trend will continue in the future as well.
Ethiopia can achieve that. Ethiopia in fact is on its way to achieving that. If we maintain the current response, if we continue to scale it up, if we continue to target the hard to reach populations, if we continue to make sure that people know their status. That's why HCT today in Gambella was very, very important. You saw the response. So it is achievable, but it's not something that you achieve by just wishing it. You have to do something about it. The commitment, and as evidenced by the president of the region, as evidenced by Minister Kasete from Ministry of Health. So Ethiopia, I have no doubt in my mind, will achieve that.